Differentiated practice. What is it? Differentiated practice can be defined as a philosophy that structures the roles and functions of nurses according to their education, experience, and competence. It views nursing as a whole that is made up of many parts, each related but with its own distinct function. I will discuss the role of education in creating a diversified nursing profession. First, I will discuss the different levels of nursing education. Diploma nursing programs are often thought of as a thing of the past, but they do still exist. This type of program usually involves a school of nursing that is directly associated with the hospital and awards students with a diploma upon completion. Diploma nurses take the same licensing exam as other registered nurses. Associate degree in nursing programs were established when there was a shortage of nurses after World War II. Although some liberal arts studies are included, the primary focus is on the technical nursing knowledge and skills. These programs usually take 2 to 3 years to complete and are more affordable than a bachelor's degree. There are now many institutions offering RN to BSN programs that allow ADN nurses to advance their education. Recent studies have shown that although ADN nurses are the most common, they are slowly being pushed out of the hospital and into long-term care settings. According to the American Association of Colleges of Nursing, baccalaureate nursing programs encompass all of the coursework taught in associate degree and diploma programs, plus a more in-depth treatment of the physical and social sciences, nursing research, public and community health, nursing management, and the humanities. These programs take 4 to 5 years to complete. Typically, students spend the first 2 years studying liberal arts and sciences, followed by 2 to 3 years of nursing coursework. Since 1965, nursing organizations have called for the BSN to be the entry-level degree for the nursing profession. A recent study from the University of Michigan found that a 10% increase in the proportion of baccalaureate-prepared nurses on hospital units was associated with lowering the odds of patient mortality by 10.9%. There are many more studies with similar findings. It's simply that baccalaureate-prepared nurses provide a higher quality of care. There are many types of master's degrees offered for nursing. First, there are the advanced practice nursing degrees. The most well-known of this is probably the nurse practitioner. NPs can specialize in many different areas or take more of a generalized approach. Second, there is the clinical nurse specialist degree. Nurses with this degree will focus on a certain area, such as pediatrics, and become experts in that one area. In practice, they can do many different things, but are often found managing a department or working as a consultant. Certified registered nurse anesthetists are trained to administer anesthesia. Being accepted into a CRNA program is highly competitive, and they often earn higher salaries than other advanced practice RNs. In the near future, though, all CRNAs will be required to obtain a doctoral level degree. Certified nurse midwives specialize in pregnancy, delivery, and gynecological care. Clinical nurse leader is a newer master's degree that prepares nurses for leadership positions in healthcare. And master's degree in nursing in a functional area specializes in areas such as education or administration. Doctoral level nursing degrees come in 2 varieties. Typically, these degrees are earned after completing a master's degree, although some schools are now offering BSN to DNP programs. The PhD, or Doctor of Philosophy in Nursing, is a degree focused on research. PhD-prepared nurses generally do not practice. After completing a master's degree, a PhD student will spend 4 to 5 years studying, researching, and writing a dissertation. Work afterwards is often found in research or education. There is a shortage of PhD-prepared nurses. The Doctor of Nursing Practice is a doctoral level degree intended for practicing professionals. This degree is new and controversial. Nursing organizations desire to make all advanced practice RNs obtain a DNP in the coming decade. Education is vitally important to professional practice. Education creates a profession made up of critical thinkers who share a thirst for lifelong learning. Advanced education creates more research to further advance the knowledge base of nursing in general. In addition to this, having set educational standards ensures that all nurses have a certain level of knowledge. Accreditation of nursing programs ensures that the program meets educational requirements to prepare students to become practicing RNs. There are two major accreditation bodies: the Accreditation Commission for Education in Nursing, or the ACEN, and the Commission on Collegiate Nursing Education, the CCNE. The ACEN accredits all types of nursing programs, from diploma and ADN programs all the way up to postgraduate level studies, such as DNP. The CCNE accredits only BSN and higher level programs. A few other accreditation bodies do exist, including the Council on Accreditation of Nurse Anesthesia Educational Programs, or the COA, which accredits CRNA programs, or the American College of Nurse Midwives Division of Accreditation, which accredits midwives. The Essentials of Baccalaureate Education for Professional Nursing Practice is a document produced by the American Association of Colleges of Nursing. This document defines the essential elements of a BSN program. It is the standard by which baccalaureate nursing programs are measured. So let's wrap things up. There are many different types of nurses within the nursing profession, and they all have a role to play. Education plays an important role in creating a diverse and differentiated profession. Finally, accreditation bodies ensure that education is effective and standardized across the country.